Type 2 diabetes, also known as non-insulin dependent or adult onset diabetes, is a chronic metabolic disorder in which the body cells have become resistant to insulin. People can also acquire this disorder from a genetic predisposition. Insulin is a peptide hormone released by beta islet cells of the pancreas. It triggers glucose uptake of cells. Because of the resistance of the body cells to insulin in type 2 diabetes, cells cannot properly absorb glucose.
Glucose enters cells through glucose transporters. The peptide hormone insulin stimulates cell uptake of glucose by acting through the glucose transporter GLUT4. Upon the binding of insulin to insulin receptors, a signaling cascade triggers the exocytosis of GLUT4 transporters. Glucose is then allowed entry into cells once GLUT4 transporters have fused with the cell membrane. The following demonstration will show the mechanism by which insulin triggers the transport of glucose into cells. The bowling pins represent the phospholipid bilayer of the cell membrane. The yellow ball represents an insulin molecule, and the initial domino formation to which it crashes into represents an insulin receptor. The domino line represents the signaling cascade by which GLUT4 is stimulated to undergo exocytosis. Lastly, the red ball represents a GLUT4 transporter. Meanwhile, in an abnormal cell of a patient diagnosed with type 2 diabetes, disruptions in the signaling cascades involved in GLUT4 translocation results in insulin resistance. This leads to less GLUT4 transporters fusing to the cell membrane via exocytosis, leading to less glucose being taken into muscle and adipose cells. An increase in blood osmolarity leads to water being drawn into the circulation and out of the cells, leading to increased thirst, more frequent urination, and increased hunger. Type 2 diabetes can also lead to diabetic eye diseases, such as glaucoma, diabetic retinopathy, and cataracts, as well as diabetic nephropathy. Other symptoms include sudden weight loss, fatigue, vaginal infections, and numbing of the extremities. Type 2 diabetes is a manageable disorder. Through a change in lifestyle, an affected patient can delay or even prevent further complications. A diet consisting of high fiber, low fat foods, and the exclusion of refined carbohydrates and sweets will help manage glucose levels. Exercising is another great way to control glucose levels, as physical activity lowers one's blood sugar. However, many people who have type 2 diabetes need more than diet changes and exercise in order to manage their disorder. In these situations, medications can help. These include metformin, trade name glucophage, sulfonylureas such as glimepiride, trade name Amaryl, thiazolidinedione such as resiglitazone, trade name Avandia, and SGL2 inhibitors such as canagliflozin, trade name Invokana. Insulin therapy can also help in managing type 2 diabetes. An example of a type of insulin used in insulin therapy is insulin glargine, trade name Lantus. Bariatric surgery or weight loss surgery is another option for type 2 diabetes patients with BMIs over 35. Studies have shown that the most effective type of bariatric surgery in managing blood glucose levels is the gastric bypass surgery known as Roux-en-Y anastomosis.